Hello everyone. Today in series of Docplexus KOL interviews, we have with us Professor Adel El Sayed. He's from Egypt and he's the professor of internal medicine and diabetes. He's also a WHO consultant. He's the president of Egyptian NCD Alliance and the ex-chair at International Diabetes Federation in the MENA region. He was also the ex-president of Diabetes in Asia Study Group. Thank you so much, Doctor, for this interview.
Thank you very much.
So, we'll begin with the first question. Could you please elaborate on the cardiovascular complications in diabetes?
Well, this is an important issue because between 7 and 8 out of every 10 diabetes patients will die because of cardiovascular complications. So, cardiovascular complications is the main cause of mortality, we call it mortality, the main cause of death for diabetic individuals. So that's why when we treat diabetes, we have to think of the cardiovascular system, how to prevent cardiovascular complications. And that's why some of the more expensive drugs which were recently produced, they can cause a reduction of cardiovascular complications of diabetes. And this is quite important actually because as I have said, this is the main cause of mortality among diabetic patients. So treating this and putting an eye on that is very important. Actually, now they used to say that diabetes is a cardiovascular equivalent, meaning if you have a patient who has myocardial infarction or angina, well, he is very likely to develop another attack of cardiovascular complication. If somebody is diabetic without any previous history of having a myocardial infarction, he had the same chances of developing myocardial infarction in spite of not having a previous one. So this is important just to illustrate the importance of diabetes in occurrence of myocardial infarction. The other issue is when myocardial infarction develops in a diabetic individual, the prognosis, the outcome is much worse than if that patient is not diabetic. So it's very important actually to focus on the cardiovascular complications of diabetes because they are much more important than the increase in blood glucose itself. This is the main cause of killing people actually. That's how diabetes kills people, in that way. So this is very important.
So doctor, moving on to my next question. What is the importance of addressing and treating prediabetes?
This is in a way related to the issue of cardiovascular complications because we are sure now prediabetes is the area between normal and diabetes. You know, this is an intermediate stage between normal individual and diabetes. For example, for diagnosis, I mean, if my blood glucose is less than fasting blood glucose is less than 100, I am normal. If it is more than 126 milligrams per deciliter, I am diabetic. If in between 100 and 126, I have what we call impaired fasting glucose or prediabetes. The same thing with postprandial, after the level of glucose after meals. If my blood glucose is less than 140, I am normal. If it is more than 200 milligrams per deciliter. I am diabetic. In between, I have impaired glucose tolerance. And this is again pre-diabetes. So these two groups together are called pre-diabetes, and they are very important because most of those people will progress to have diabetes after some time. That's number one. If I would like to prevent diabetes, I have to test those people and choose that category of people, that sector of individuals, and work on them. All the studies, all the trials which had been done to prevent diabetes, they targeted that population, that group of individuals. So those are the people who will develop diabetes, and if we would like to prevent diabetes, we have to work on those people. The third thing is, and which is very important actually, and that was the topic of my lecture today, is that prediabetes in itself can lead to development of cardiovascular complications. So those people with prediabetes can develop cardiovascular complications even without progression to diabetes. So this is very important. And those people are mostly overlooked because you are not diabetic. So just wait, when you are diabetic, just come back to be treated, and this is bad. We have to address those people. We have to know them. We have to diagnose them, and we have to intervene with them actually to prevent the complications which might happen to them. This is very important.
So doctor, you were the ex-chair of the International Diabetes Federation of the MENA region. Yeah, so what are the observations that the similarities in diabetes in Egypt and in India?
Well, Egypt and India, there are a lot of similarities. There is some differences, of course, but there are a lot of similarities over there. I mean, the category of the economic status in both countries are similar in a way. I know that India is progressing rapidly now, but well, I like that actually. I have to say, I like that. I visited in India several times, and I can say comfortably that I can see the progress in the streets of the cities of India, even by the naked eye, and well, that makes me happy actually for the Indian people, just to see them in a prosperous and advancing situation. But still, the community in India and the community in Egypt are similar in the generally in the socio-economic status of the people over there. This will impose certain problems on both communities. For example, the inability of the people to use the recently introduced very expensive drugs. We have to be wise in treating people in both communities actually, because, well, the recently introduced, they call them the modern anti-diabetic therapies, well, they have some benefits, but meanwhile they are quite expensive, and we have to be cautious actually, because diabetes per se is a very expensive sort of disease, especially because of its complications. You know that if somebody goes for coronary bypass, for example, or fixing some stents, or having renal failure and have kidney failure and have this dialysis and all this, it's very expensive. So have to be cautious regarding using expensive therapies in both communities. The second issue is the prevalence, the high prevalence of diabetes in both India and Egypt. Egypt is slightly more in the prevalence of diabetes, but the size of the diabetic population, the number of diabetic individuals, of course, Egypt will do nothing compared to India due to the huge number of the general population of India. So the number of diabetic individuals in India is much, much larger than those of Egypt. In Egypt, we have almost 8.5 million diabetic individuals in I can't remember exactly the name and the number, the figure of India, but definitely it's several tens of thousands. I can't remember the figure just now. So there's a lot of similarity. I mean, the Eastern pattern of food, there's a lot of similarities between Indian and Egyptian people. And there is one more similarity, which is the genetic predisposition to diabetes. Egyptians, people in the Middle East, and people in Eastern Asia are having increased predisposition, increased likelihood to develop diabetes more than the Western people. So there are a lot of similarities actually between the two countries. In addition to that, you can say that the cultural status of the people, the degree of education, we have a lot of people who are still illiterate or less educated than the Western countries, and this will affect their attitude and their ability to understand and to observe and themselves and their health regarding diabetes, because the more you are educated, the better will be your ability to keep yourself more healthy, because you need to have mean blood glucose estimation, and you have to look at these figures and might be to change your lifestyle, the ability to understand the meaning of the figures, and so you need to intervene in the treatment of your diabetes if you are diabetic. So this is important. So there are a lot of similarities actually. The differences will be in basically the numbers, of course. It's a huge scale in India compared to Egypt. Egypt is a big country. Egypt is we are approaching 100 millions now, but this has nothing to do with the population of India, of course. So we are a big country among the countries of the Middle East, but compared to India and China, we are just very small country. So these are the similarities and differences between the two countries.
Okay. So doctor, I would like to ask you my next question. And based on your experience, what are the preventive strategies for diabetes?
If we would like to understand what are the preventive strategies, we have to understand why diabetes is increasingly prevalent in the whole world. The estimates say that the increase in the percentage of diabetes, the prevalence of diabetes during the first half of the 20th century, during the 50 years, was 15%. Now, the number of diabetic population in the world is doubled after 2 decades, every 2 decades. So it's a huge increase and progress in the increase of the prevalence of diabetes, prevalence and incidence of diabetes all over the whole world actually. And this is because of the change in the lifestyle which happened by the middle of the 20th century. Man is living on Earth for the last 3 million years. These are the estimates. And man dreams all through these 3 million years just to have food, not to have hunger, not to have famines, because famines killed more people than all diseases and all wars together in the very past history of the human beings on Earth. The second dream of human beings was not to do muscular work, you know. If you'd like to go from Mumbai to Delhi, you have to have, to walk or to have a camel or something just to travel. It's very very easy to do that. So both dreams were suddenly achieved in the first half of the last century. Man controlled the production of food. Now, the food produced on Earth is more than the need of the population. And the famines you are hearing of, you are knowing about, is due to bad distribution rather than deficiency, rather than actual deficiency. So we have got enough food just now, and you control the production of food. So famines are very, very fewer in number. The second issue is we stopped exercising because we invented the car, we invented the lift, we invented the remote control, just not to go to change the channels in your TV, you know. So we started to live a sedentary life, less active. We do not move. So these two factors together, food is available and easy to get and cheaper, and no exercise and no movement. If you put them together, you will have obesity. Then by the middle of the last century, obesity appeared as a very increasing sort of disease. It is a disease, of course. And diabetes and obesity used to run parallel to each other. When you have a high prevalence of obesity, you expect to have a high prevalence of diabetes as well. So that's the cause. So if you understand that, you can understand the strategy of prevention of diabetes. Just try to reverse that. Try to combat obesity by, well, there had been a slogan for the International Diabetes Federation saying, eat wise and exercise more. That means that you have to eat less calories just to keep your weight, and you have to exercise more because that will help you to control your weight. So these are the basic strategies actually, is to control weight through dieting and exercise. These are the basic principles of prevention of diabetes, is changing the lifestyle. And changing the lifestyle means dieting and exercise. But in addition to that, there have been studies which used drugs to prevent diabetes. And a number of drugs were successful in prevention of diabetes. The most important is metformin, the cheap and commonly used drug. It was very successful in prevention. So prevention of diabetes basically is by changing lifestyle, and this is easy to say, but it's difficult to apply just now. The implementation of changing lifestyle is not that easy as it appears for the first look. And you might be able to use drugs, and the most important example is metformin. And prevention of diabetes is the most important strategy to deal with diabetes, just to close the tap rather than just to try to dry the ground from the water coming from the, you know. So prevention of diabetes should be done through lifestyle modification.
All right. So, Doctor, WHO formed the latest guidelines on the treatment for the drug on treatment of diabetes. So, you were a part of the committee. Yeah, so, could you please elaborate on that?
Well, I had the privilege to be part of the member of the committee which produced the last guidelines of the WHO, which appeared in the Journal of Annals of Internal Medicine just 10 days ago or something. These are very important actually, because the problem now with treating diabetes is that there had been a tremendous and enormous pressure on physicians by the pharma industry just to take them to prescribing more and more the newly introduced and very expensive drugs. the WHO, the pharma industry, has no influence whatsoever on the WHO. Maybe the WHO is the only place where the pharma industry has no effect. That's why it was a sort of, we are free from pressures from everywhere, and they recruited people just to explain to, we are physicians at the end of the day, we are clinicians. So to explain how to rank different studies and trial, and how to classify them into important and less important. And they explained the medical economics to the group. We are not experts in medical economics. So after these discussions, it was a long story, including for so many days and working all the day and things. The recommendations of the WHO was to use the old cheap drugs and the old and cheap insulin, rather than to use the more expensive recently introduced drugs, because they discovered that the improvement, the gain which one can get from using these drugs doesn't worth the increase in the price which happens. So if you can make use of your budget rather wisely, that would be in a good favor to the whole community. So this is the basic merit of the recent guidelines of the WHO.
Thank you so much, Doctor, for the interview. It was a pleasure having you here.
Thank you indeed. Thank you very much. Thank you for inviting me actually to come to this important meeting in Mumbai. I'm happy to be here again, and I look forward to be here again and again. Thank you very much.
Thank you so much.
Thank you.